McKenna, you still there?
Yep, I'm still here.
Cool. Hopefully, Brennan isn't recording, because if he is, he's going to have the answer. Okay. Number one, stop me if you have questions. I'll just give you the answers, and if you have questions, stop. Number one is C. 2 is B. 3, B. 4 and 5 are A. 6 is D. 7 and 8 are B. 9 is A. 10 is B. Any questions so far?
What was,
What was
6 and 7?
6 is D and 7 is A. 6 is D, 7 is A. I'm wrong. 7 is B. Yeah, 7 is B.
Okay.
No, 6 is D, 7 is B.
Okay.
8 is B.
8 is B.
9 is A. 10 is B. Are we good so far?
Mhm.
Cool. 11 is A. 12 is D, as in dog. Give it to you the way Tara gave me over the phone. 13, cat. 14, apple. 15, boy. 16, dog. 17, cat. 18, boy. 19, apple. 20, boy. Questions so far? 21, cat. 22, dog. 23, boy. 24, cat. 25 and 26 are both boy. 27 is cat. 28 is boy. 29 is dog. 30 is apple. 31 is dog. 32 is cat. 33 is dog. 34 apple. 35, 36, and 37 are all boy. 38 apple. 39 cat. 40 boy. 41 apple. 42 cat. 34 apple. I'm sorry, did I say 34? 43 is apple. Wow, I'm being dyslexic tonight too. 44 is D. 45 is C. 46 and 47 are A. 48 is C. 49 and 50 are both D.
Can you let us look through and see if we have questions on the ones?
Yep,
we
look
know?
through them.
Okay.
Look through them and let me know what questions you have.
Thanks for giving from you.
Can you what?
Right on you.
Right on it, it's yours.
Oh.
What was the, I still can't get to the test database. So
C.
Number 1 was C.
What was 33? It was D, right?
33 is D, as in dog.
Um,
We do better?
How many could we miss? Like the last ones,
10.
I was super frustrated.
10 would be the A.
Well, I made it. I still got a bunch.
Okay, McKenna, how did you do?
I missed 10.
Yeah.
Is there any that you want to discuss, McKenna, or are you still looking?
I think I know where I messed up.
Okay,
I changed the real answer. Which one is it?
Nicole was erasing. It makes me nervous when people erase,
I know it's been no.
especially when Aaron erases. She overthinks things and gets herself in trouble.
But two of them are the way you walk the left one, so.
Did one go the other way?
Doesn't know.
Was it right?
Right, that's right, but I cannot remember. Right, something with D, right? Okay. Right. Yeah. Probably. 23 history. Right. Or was. We don't even carry a 14. Oh, yeah.
No, we don't.
Question.
The point is, the lower the number, the bigger the.
There's also 10 games. Oh, we don't have them. So
Okay.
use those for check those.
Actually, you might have a 14, but yes, they're chest starts.
So number 9, I didn't really, I got it right. Right? Number 9 was C,
Parenteral,
or number 9 was A.
that was A.
So I got that wrong. What does that mean? Parental? I didn't know what that meant.
You know, I was thinking they were through the.
I put C. I put C too, because it was the only one not.
Yeah, it's C. Did I
Is it
mark that
C?
wrong? It is C.
It's C.
I thought A didn't fit. I
Okay.
did. Number 9 is C, not A.
In that case, I only missed 9, Becky.
All right, deal. You're right. That one I got wrong. Because the ones are taken internally and the rest are all
That's what I thought.
through the GI tract and the rest are the parenteral are outside the GI tract. Hello.
I'm back.
Good, good. They're still checking answers and comparing. Oh, she's got a good shirt for doing standby. She's got a good shirt for football standby. It's yellow and has the blue star of life on both sleeves.
Oh, you know what? I thought it was marking.
Mark the wrong one.
Oh my gosh, I did. I told myself it was that. Oh, darn it.
And by the way, on which one was it? On 6, there's 2 B's.
Yeah.
I'm glad you guys ignored that.
Yeah.
I was lucky. I did this thing first thing this morning because the rest of the day went to pieces.
Let's see.
Yes. Brennan, did you take the test? Hello, hello. The audio isn't working. That's because I had it muted. The rest of you can hear me fine, can't you? Good. So do we have more questions or can we go on and discuss it later? No. I need it.
You didn't know that. Last time you didn't ask.
Put that aside. Today we need to do patient assessment. A lot. We'll leave it at that. Can somebody tell me what the parts of the scene size up are? There's 5 of them. So peek at the answers. What's a part of a scene size up? Scene safety. How do we know if a scene is safe? And when does chapter 10? How do we know if a scene's safe?
Look around, look for hazards.
Look around. What kind of hazards are we looking for? For what?
Power lines that might be down.
Power lines that might be down? Make sure a vehicle is stabilized.
Whatever cause the injury is gone.
Be aware of violence. What kind of things would you see that might make you suspect domestic violence?
Those kinds of injuries.
I went in a call one time, and the longer I was in there, the more I was suspicious. I'm ready to
When
get
the guy standing
Ow.
over here. Wait,
No, there was no guy standing over
Oh,
me.
that's good.
But there was a picture that was smashed, the glass was smashed out of the picture frame on the wall. The table was tipped over, coffee table, and broken. There were things scattered all over the place.
No.
But according to the person,
So
she
then-
fell on the table and broke it, and that's what happened. Which is plausible, because part of what was scattered was pills of all assorted kinds, all the way through the house. So it could have been. Went into a scene once that was told it was a chest pain. It was kind of suspicious because this person said, "Don't, dog's coming with me. Son's staying here." No, actually, she wanted son to come with us. Son wouldn't come with us. The dog's coming. Son really needs to come. He wouldn't come. As we started to drive away, she said, "I'm fine. He's suicidal and threatened my dog. He was going to shoot my dog." Was that a safe scene? No. One of my dear little souls who was driving for me ran into the house after said son. Did I panic? Yes. He had no business going in that house after this young man.
No.
Anyway, if you suspect it is not safe, you're not to go in, what should you do? Call for law enforcement. If you're nervous going in, call for law enforcement. Oh, can you tell Sarah and Buck to join us, please?
Oh, okay.
I chased them both away. Okay, so scene safe. What else? I need to turn my speaker up so I'm sure we should hear these guys. Actually, I need to turn, I think I can turn this up. Say something, Regina.
We can hear you well. Sometimes we cannot hear the rest of the people in the class though. So it's good when
That's not good.
but it's good when you repeat that. You do that all the time, so we're good.
Volume. Oh, it is up. Hi, Sarah dear. Okay, so we're talking scene safety. Scene size up. First thing is to make sure it's safe. What else is on there? Number of patients. What do we need to know the number of patients right away? Yep. Do we need more help or not? That's what scene safety is telling us too. Do we need more help or not?
Yes.
BSI. Make sure you have that protective stuff that you need before you need it. Soon as you see somebody's bleeding, get it on before you touch them. Don't be like me and walk up and grab the C-spine and say, "Oh," or help them scoop them up off the floor and go, get your stuff on.
Hi, Becky.
Yes,
I was having technical difficulties. What chapter are we in, please?
we are on chapter 10, patient assessment.
Thank you. Thank you.
393 in the third edition. So we're ensuring our scene safety. We're taking our BSI. We're determining how many patients we have. We considered resources because I threw that out there. The other one is a mechanism of injury. Help. And mechanism of injury or nature of illness. Okay. I don't know if you guys can see that. I'm sorry, I can't move the table. Well, I can move the table closer. It might help. I don't know why I can't. It puts it closer to the TV too. All right. So that's our scene size up. What is our primary survey?
Level of consciousness.
Before ABCs.
Check the level of consciousness.
Okay, precautions. Q. What do you do first thing when you walk in and look at a patient? Okay, you're going to get a general impression. Yeah, something like that. General impression. Then the two first things you're looking at are, these are things that are life-threatening. What do we got? You're checking their level of consciousness and bleeds. Then you're going to assess and fix your airway. What are you looking at with airway? It's open. If they have one?
If they have one, yeah,
Airway, do we have one? Do we need to open it? Up here, if they have an altered level of consciousness, you're going to open an airway if they're not breathing. What else do we look at for level of consciousness?
AFPU.
What determines this?
AFPU. We do AFPU.
You're right, AFPU. Are they alert, verbal, painful, or unresponsive? If they're bleeding, you're going to fix it. If they're not breathing, you're going to get airway open. This moving, if they're bleeding profusely, moved up. It didn't used to be there.
Yeah.
But if it needs fixed, it needs fixed now. If they're not breathing, that needs fixed now. Okay. So airway, do they have breathing? Is it adequate, or do we need to fix it? If there's just a couple people and they're not breathing, you're going to be spending your time breathing the whole way over, and you might not get any further. Trying to keep them breathing. Okay. So you have your airway, your breathing, and
CMS.
circulation. What could be a circulation problem besides bleeding? What?
No.
Shock. Cardiac dehydration. Cardiac arrest.
Are they bleeding out? Do we need to expose them?
Mm-hmm. Um,
Lack of perfusion.
yeah, if there's no perfusion, there's a breathing problem. Or a circulation problem, one of the two. We've talked about how a person who's having trouble breathing might be sitting, kind of leaning forward. They might have their lips pursed, breathing hard. They might be in sniffing position. They might be breathing really shallowly. First football game I went to, this kid took a really hard hit. They yanked him to the sidelines. Mom had me trying to listen to lungs. Kid was breathing super shallow because it hurt to take a breath. So I had to report, I can't hear the lung sounds. She went over and said, take a deep breath. He obeyed her, and he had fine lung sounds. It just hurt because he had just taken a hard hit. What are some signs of respiratory distress? Early signs. Okay, there can be some confusion. They can be agitated, really restless, don't want you in their face. They're having a tough enough time breathing. What are some sounds we might be able to hear? And clear across the room. You can hear Strider. Another one you can hear clear across the room sometimes, freezing. Okay, are they using the accessory muscles here in the neck and in the chest to try to breathe?
Cyanosis. They're
It's called
pale.
what?
Cyanosis.
Yeah, they'll be cyanotic. They can be breathing really fast or really slow. They can just be breathing, their heart rate is increasing. So it might be mildly fast, but not super fast yet. What else can we see? Especially in little kiddos. What can we see in little kiddos that are having trouble breathing?
Those accessory muscles.
You really see
Diaphragm.
those muscles. Have you ever seen somebody doing this? And their head's moving with it? Have you ever seen somebody with their nasal flaring going on? And they have what's called seesaw breathing sometimes. The chest and the stomach are doing this. Because they're pulling so hard trying to breathe in and expand that chest that it's going opposite ends. Okay, when we start getting a respiratory failure, what are we going to notice? If we can't fix it while we're in respiratory distress, what's it going to lead to? Okay, so what kind of things are on the failure side? Okay, they can't stop breathing, but before that, their two sets start strapping. Right, they're going to go up and then they might go down. There might be periods where they're intermixed. Eventually, you're going to get to agonal respirations. You're going to get the funky respirations where they're breathing really fast. You're going to get ones where they go really fast and then really slow and really fast. And you're going to get some that are just totally mixed up and they're not really, there's no pattern to it. They're just crazy. Apnea is when it stops.
No, that's what it's at.
Too small or fast. Tachycardia. Tachypnea. Tachypnea. And bradypnea. You might see the chest not really rise or go down like it should. You can see an inadequate respiratory rate or effort. If you see just really shallow breathing and they're not getting the amount they need. If it's shallow, they should be breathing faster to make up for the shallow amount. If they're breathing really deep, it should be a little bit slower. The super fast, what are small respirations? Anybody remember?
DKA.
Right, diabetic ketoacidosis. They're gonna be breathing really fast and deep because they're trying to blow off all the acid they can to get rid of the acidity in their body. Eventually, it doesn't work. And you're going to see decreased muscle tone as they start going down. They start getting weaker and weaker and limper. And there's the muscle tone. Okay, so what's the pulse supposed to be like? We're still over there. What are we looking for? First of all, do you have one? Is it perfusing? What color is the skin? What temperature is the skin? As the blood vessels start to constrict down, they get colder. If they open up a lot, they can radiate a lot of heat. Moisture, are they diaphoretic? They get pale, cool, clammy. Are they dry? Could be heat stroke type stuff. What? Who is capillary refill really good on? Little kids. How come it's not so good on adults? Your circulation, peripheral circulation, will start going downhill. Okay. Of course, if you see any external bleeding, you're going to try to control it as soon as you can. If there is no circulation at all, you're going to start what? Compressions first. And then go to the wrist. So those are the things that we can assess and fix. Some other things you're going to do. There's A, B, C. Then they add a D and an E. Do I know what D and E are? Okay. Disability. Do a neurologic exam on them. See if there's something that's lacking. That's why we do the squeeze my hands, follow the finger. What? Smiling. Yep. Stroke assessments are checking for a disability. Sometimes they might have something normally like Alzheimer's disease. My dear mother-in-law now can ask you the same question every 2 to 3 minutes. Honestly, not knowing the answer. She what? No. So it doesn't do any good to yell at her. My mom went through that too. Any deviation from being alert and oriented to person, place, time, and event, or from their normal baseline. Not everybody has the same baseline, but somebody nearby could probably tell you what's normal. Do your Glasgow coma score on them. E is what? Especially in trauma.
Environment.
We're going to expose them. If it's a medical or a complaint that's located just one region, and there's not a major mechanism of injury, you can look just at the one region. If they've been in a car wreck, you really need to kind of see everything. If they have some weird rash here, you might want to check around and make sure they don't have it other places too. So do a rapid full body scan. We are identifying 3 things. What do we want to identify by doing all of this? Yeah. Again, identifying. Oh, no.
Did
Okay.
you say skin signs?
By doing all this, what are we getting out of this? Chief complaint. That's one. Once we have a chief complaint, what do we decide after all that? How we treat them? Transport and priority, right? How high of a priority are they and how fast we gotta get them out of here? Sometimes I think we stay on scene longer than we should, and other times you have time to stay and play. Do we need to load and lower? Do we have time to stay and play? Okay. Then it takes you into history. What's the first thing we need to know about history? Okay. P, Q, R, S, T. What's it stand for? Oh. Onset.
Provocation.
Provocation. Quality.
Radiation.
Radiation. Clarity. And time. What's the difference between onset and time?
Onset is you're trying to find out how long it's been going on. The onset might have been acute, it might be an acute episode where it just started 10 minutes before they called for an ambulance,
Okay.
or it could be, oh, well, it got really bad 10 minutes ago, but I've been having this pain at a lower level for 4 days.
Right. So onset's how it came on. And time is what time it started. Or, okay, if it's been going for days, why did you call me now? And what time did that change happen? Huh? Sometimes it's a very slow progression. Okay, so tell me about this progression. Okay, past history. How do we learn that? That sample. What's that? Signs and symptoms. What's the difference? Right. Signs are what you see, just like when you drive down the road, you see signs. Symptoms are what they tell you that you can't see.
One
My
is-
sinuses just really hurt right here, and if you touch me, I will scream.
Like one's a subjective and one's objective, no?
Is what?
One is subjective and the other is objective.
Right. You got it. One is their interpretation of what's going on, and the other is what you see. Okay? Allergy. Why do we need to know that? Particularly when we start giving them meds, or if that's the problem.
Where they get exposed to.
Okay? Meds. Was that just their prescriptions? Anything. Over the counter, prescription, recreational, Tell me what you took. And
Don't
no,
care, but.
I'm not here to tell the cops. I'm not gonna judge you, but tell me what's in your system so I know how to fix it. What else did we learn from meds? Yeah. Written medical history.
You're on a thyroid, right?
If they're not conscious, look at their meds list. That can tell you a lot about them. Uh-huh.
Passes out, told the deputy that was there, they had taken some pills this morning, and all his pills were in the truck.
Oh, wow.
So the deputy brings over
A box.
a box. And all of his meds are from the VA except for the aspirin, and I'm like, okay, we got aspirin, we've got blood pressure angina, because they actually said, take this for this. He had
Oh,
two
cool.
medication bottles for prostate stuff, 3 different ones for diabetes. The
I was
blood
gonna
pressure
say
angina,
staggered and
and
Brad
then-
would take my mind to diabetes.
and I was like, okay. I'm like, and I didn't recognize most of the names on the bottles other than, I'm like, well, we know he's got something with his prostate. He's like, right. I don't know. I'm like.
Well, and they don't always take it for what it's prescribed for.
Well. like I said,
Terrell's on, I can't think of it at the moment. It's a cardiac med. But it's not for the cardiac, I mean, it's a blood pressure med, but he's there because it also calms the heart down to stop the atrial fibrillation. Yep, that's it, metoprolol. And he's on metformin, not because he's diabetic, but because it's helping him lose weight. So sometimes not only just knowing the meds, but we have to ask, well, what's it for? And they'll say, oh, you're diabetic. No, I'm not diabetic. I take it because I'm losing weight. Yeah,
At
boy.
least let us check you over here, but.
Okay, now, that's a hard one. We always forget this one. Last oral intake. I always forget that one too. Then I go get to the paperwork and I go, crap. Okay, I ate breakfast at 5 o'clock. But I told you I'm just coming from the Dirty Sally's because I got an ice cream cone. But I ate breakfast at 8 o'clock. So last oral intake could be a whole lot closer than what your last meal. E. Events. We came over to get an ice cream cone at Dirty Sally's, and we were headed back over the mountain on our little motorcycle, and we smucked into this dang deer. And I managed to not put the bike down, but she got her foot stuck dragging behind us, and so her foot's hurt. It gives you a lot of information and just a story. Last motorcycle was doing about 10 miles an hour. But again, got foot tangled as it went down. And him. Okay. Secondary assessment then. What's a secondary assessment if it's a trauma? Before that. That is the head to toe. You're doing the rapid trauma assessment. Let me make sure there's something that, I mean, you have this really pretty ankle here with bone sticking out, and it's gorgeous and all, but let me see what else you got going on. Because your elbow over here can't straighten out. And you can't feel your finger over here. Or you got what? Yeah, there's a hole here. There's a really, when you went down, you fell on this stick and it's kind of sticking out of your back. So what are we looking for? What's the little initials for the rapid trauma assessment? Right. CAP, that's an A. CTLS. Okay, anybody know what D is? Deformities? C? Contusions, eh? Abrasions. P? Punctures? No.
Oh.
Burns. Burns?
Tenderness,
Does this hurt when I touch here?
Tender.
Tenderness,
lacerations,
lacerations, and
swelling.
swelling. Good job. So you're doing a rapid head to toe. You start at the head, you're going down, checking all the bones, checking the neck, especially the spine and the back, checking your gloves for blood every time you see your gloves, checking the shoulders, checking here, take a big deep breath. Is it equal expansion? If you happen to have a stethoscope, it's handy to listen while you're there because the lung sounds are on the sheet. So listening to lungs is good, especially when you're on scene, because once you get them in the rig and somebody hands you a stethoscope and says, here, listen to the lungs, it's awfully hard. Even if it is the fancy electronic ones, I still couldn't hear. So go on down, still reaching under the back if they're on their back as far as you can. Check the pelvis, make sure it's stable. Be cautious as you do that. We're not just going and jamming down, because if it's crushed, you're going to be shoving them into all kinds of pieces. So caution. Go down the leg, make sure you don't have any bones broken there. Is there a pulse? Can you feel this? What toe am I touching? And can you wiggle your toes? Go down the other leg. Is there a pulse? Can you wiggle your toes? What toe am I touching? Go down each arm and doing the same thing. Can you wiggle them? Can you feel them? Is there a pulse? That's your rapid head to toe. When you go to put them on a board, be sure and check the back, because the back needs checked. If they're on their face down, do the assessment as well as you can. When you turn them, be sure and check the other side. I like it when they're standing. It's kind of handy. You could do head to toe real easy. Okay. What would make somebody a high priority?
Controlled bleeding.
Or what?
Uncontrolled bleeding.
Uncontrolled bleeding. This one, life-threatening bleeding. Let's go through so you can see it. What else? Not breathing or difficulty.
Compromised airway.
Yep. Cut, not cut, different cut.
Serious burns, airway burns, possible.
Serious burns, especially involving an airway. That's where you want an airway, advanced airway, as soon as you can, because that's going to swell and you're not going to be able to get it. Our last patient, medic was told if he had not gotten it, they would not have had a patient. And what's this got to do with it?
If they're not alert, if they're only responsive to painful stimuli.
Yep. If it's painful or unresponsive, they need to get out of here. I actually saw a nurse one time. Once we got him over there, we were saying we were labeling this person unresponsive, and he went up and did the sternal rub, and that didn't do anything. So he stuck his hand on it and did a compression like he was doing CPR. He said, "There you go, sternum to the spine." He responded, and I thought, "Oh, okay." Not what I would have done, but okay.
How old was the patient roughly?
How what?
How old was the patient roughly?
Probably 40s, 30s. Young enough it didn't cause anything to break, but If anybody can't feel part of their body, or they can't move part of their body, that bumps them up in priority too. A serious mechanism of injury. No matter how well they seem to be at the time, take it more serious. Especially kiddos. Kiddos scare the heck out of people because they say, stay stable, 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 stable. And I've seen that plunk on my diabetic son, was fine, pinging around and kind of walking through the house all morning, and then suddenly fell over looking like death and could not walk. And I had to carry him into the ER. Because those of you who don't know, his sugar was about 898. So what is
Wow,
this significant? Do what?
Oh, nothing.
What is a significant mechanism of injury then?
False.
Airback deployment. Okay, particularly if you're ejected. If there's a death of a person in the same vehicle. If you fell from a height, it says greater than 20 feet for an adult. I've seen people pretty seriously injured with smaller falls than that. High speed, what's a high, well, vehicle rollover. I've seen people walk away from those. A lot of people walking away. And one of them they claimed didn't have his seatbelt on. There is no way in the world that kid stayed in that convertible if his seatbelt was not on. Just because he couldn't remember and answer us correctly doesn't mean he didn't have it on. What is high speed? Considered high speed?
Anything above 40, is it?
Anything over 40. A vehicle versus pedestrian. I watched a trauma conference thing, well, a webinar about a lady that was about my age, was walking across the street after eating breakfast up in Glacier. And she got bumped by a car in the crosswalk, just enough to knock her down. And she kept saying, no, I don't want to go. I need to get up there on this trail and we need to go hiking. They got checking this lady out and she was so busted up. I don't know how she was still walking. They showed us pictures of her pelvis, her femurs, her ribs. She was so broken up. She ended up spending about 6 months in Glacier before they could let her go home. Not in the hospital the whole time. Part of it was in rehab, but oh man. And I've heard stories of people that just stepped off a curb and fell and smacked their head on the curb and had spinal fractures. I had a lady that did nothing but turn around to close her screen door and she broke her hip.
Well, and
Elderly
then nowadays,
lady, granted.
also with like the excessive use of blunt thinners nowadays. I mean, you have
Yeah,
a
they
lot
can bleed
more
like
internal
crazy.
stuff.
There's a reason they want to put my husband on Eliquis and I won't let him. They keep telling me, well, there is a slight risk of stroke. And I said, yep, and I'll recognize it and get him out of there, just like I did with the heart. So just leave him be. Yes, he's still active, and yes, he's still ranching, and no, I do not want to have to try to counteract that. The doctor himself said, yes, there's a medication to counteract Eliquis, but it costs $30,000, and I don't think our hospital has it. I said, well, why do you want to put him on it then? Leave him alone. Okay, penetrating trauma. Motorcycle crash, that can be very subjective too. It takes a lot of, it's not a set, this, or this. On the trauma sheets that you're given that you say you call in a trauma alert for this, or this, there's always provider judgment. If you see something or feel something that tells you get him the heck out of here, do it. I had somebody, he was vomiting. That's all the more I got told. So we were talking to the guy and we were discussing what he had been eating and yada, yada, yada. I didn't ask him what the vomit looked like. Something suddenly told me as my crew's moseying out to get the cot, I needed him out of there and I needed him out of there now. So I grabbed grandson, we crossed our little hands into the little seat, had him sit down, put his arms around our shoulders, and we got him out. They were just barely had the cot out and we were at the cot. And they looked at me funny and I said, come on, we're going now. My first impression was dehydration. But on the way home, I thought, no way, he's bleeding out internally. And I should have called the hospital and mentioned it because by the time the hospital woke up to that fact, he died that night. And yeah, it's something is setting off alarm bells in your head. Pay attention to it and try to investigate further. I should have called right then. I didn't have service right then, but I should have tried. Kiddos. With them, it's a fall greater than 10 feet or 2 to 3 times their height, or less than that with a loss of consciousness. Loss of consciousness always bumps whatever's going on up. A medium to high speed crash greater than or equal to 25 miles an hour or more, or a bicycle crash, especially when you jam your bike into a pickup that's driving by. That's not a good plan. Okay, history taking. I love medical because you get to be an investigator. You get to start quizzing, you find out what the symptoms are, you try to figure out what in the world is causing it. I hope she doesn't get mad at me, but at the football game the other day, I walked across the field during halftime to find my EMTs doing standby, carefully listening to the heart of my other EMT. So EMT, if you're mad at me, please forgive me. I don't want you to quit. So I listened to the story and watched and observed, and I just quietly said, did anybody test her blood sugar? And they said, no, that's not the problem. And I said, test her sugar. And she was low. But that's not the only problem. There's something else going on that's causing the problem and causing the low. So a low does not mean you're diabetic. It just means something's not going right and you're not getting the sugar you need. Yep, some people just like to be weird. Be very difficult. What if they're unconscious?
Is there a relative or a friend nearby?
You what?
I was just thinking if there's a relative or a friend nearby, you could find out how long they've been like that.
Ah, numbers there. Yes. Oh, because she was taking shots, insulin shots. Okay, bruising on her belly. Medical can be the weirdest things because people are sure it's this. Yeah, sugars can be downright scary. If all else fails, check a sugar. If someone's had a seizure, check a sugar. If someone's passed out and unconscious, check a sugar. If it's a little kiddo, check a sugar. Okay, meds if they have them hanging around. Family, friends. Sometimes family, friends can't tell you squat because I have no idea. Or the person's been fine for a long time and then suddenly has a seizure and they have known seizure disorder, but they didn't tell the friends that they were rock climbing with. I doubt they took him rock climbing again, at least in the first case. We had one this year that was diabetic and then had seizure too. Yep, got called twice. That's not the one I was thinking of though. The first one was actually out climbing at the time. Luckily, he was on the ground and not on the rope because I was, honestly, think about this. Somebody's having a seizure and they're out rock climbing. How the Sam Hill are you gonna get them off that road? Hope they have a very good belay at the bottom. Medical alert tags. Remember, those can look like all kinds of things in figure 1024. I don't know what yours look like, but they're kind of fancy ones that you wouldn't necessarily recognize. They still have that red cross, Star of Life. Phones can have histories. I actually ran into up on the mountain, we had a ER nurse that when we picked her up off the highway, she said, around my neck is a little thumb drive and it has all my medical history on it. When you get to the hospital, just have them stick it in the computer and they'll know all about me.
That's impressive.
I thought that was pretty cool. I was looking at one lady with this medical jewelry that she had a beautiful filigree copper bracelet on. And something took my attention to it. And it did have a little red medical ID tag on it. So I asked her about it and she says, yep, that's her medical ID tag that she wears all the time. But if I hadn't been sitting there, we were sharing the table at dinner one time, I wouldn't have even noticed it.
They have them on watch bands too.
They do. And my son had one that just clipped around his watch band. And I thought, oh, I hope people look for that. I was going to say, when you were saying they're not always what they were called, we got called for possible during hunting season, possible heart attack, which is not surprising because these people come from flatlands to the mountains, not in shape, and start hiking across the hills, packing a gun, trying to find a deer. Often there's a ETOH involved and other substances. But this guy, when we got him to the hospital, he was sure because his whole right arm was painful and tingling and left arm, and it was just killing him. He was sure it was a heart attack. Turned out to be gout. It was gout. But it was kind of odd. His vitals were stable and his EKG was stable. And I thought, well, something's definitely going on. But yeah, you never know. So it's fun to play detective and find out. Medical's not quite, trauma's not quite as detective. Trauma is just a matter of finding it and fixing it. And if we don't ask and we don't look and we don't get our hands there, we're not going to know. And there's nothing more embarrassing than showing up at a hospital and they say, oh, well, did you see this stick sticking out of his side? No, I think I missed that. Be sure you do a very thorough exam and you stop what's bleeding and you fix what you can on the way. And cut off clothes. You need to see them. And you know what, we've started, I wondered about this, and so my EMTs did it. I said, why don't we have hospital gowns? We cut their clothes, we look at them, put the gown on, save the hospital a little bit of time, and it works. I don't know why that's not a standard thing, but that's just me.
Trauma naked, a girl on the side of the road and left her laying there exposed. Oh no.
Oh gosh.
On the side of the road, they trauma naked somebody.
Well, if you're going to do that, at least have a blanket or a sheet, or you don't just leave them exposed.
Yeah.
I got quizzed by a boyfriend of somebody who said, is it really general practice to just cut everything off? I went to get her and she didn't have a stitch to wear because they cut everything. And I said, yes, that's protocol. Sorry, but that's the way it is. Yeah, if they're not injured, you don't have to do it. Every once in a while, there are some people that think their boots or their coats are more important than their pain. And we had one that needed his ski boot taken off no matter what. And I was watching his hand as he cut into his arm. He was squeezing so hard because it was hurting so bad. And I thought, what is wrong with you? Just let us cut the stupid boot. Anyway, okay. Getting history, there can be some really sensitive topics we need to discuss with them, such as, have you had any alcohol or drugs? Recreational drugs. We need to be sure they understand we are not cops. We need to know for medical how to best take care of them. We had somebody who was on medical marijuana to help with seizures, that wasn't going to discuss that with us. Family member told us because they were concerned, but they hadn't taken it at that time, for that day anyway. A lot of vehicle crashes involve alcohol. Another one that's hard to get a history of is things like abuse or violence. They don't want to talk about it. They want to protect the person because they love them and they didn't mean to, and they're never going to do it again. Be cautious, because if you try to separate the person, they might come after you. Interestingly enough, my grandchildren and that, I was getting after my grandson for picking on his sister, and she got after me for picking on her brother. And I thought, okay. Sexual history could be tricky. When do we need to know a sexual history? Okay, if we suspect that they're pregnant. If they are young, if they have trauma, if they have, is there any chance you could be pregnant? That's one of those questions when you're taking little old ladies over and you ask them that, that kind of adds a lot of humor to the situation. You know, ironically, I had to ask that once, and the mom said, yeah, she's on birth control. I said, okie dokie. Good to know. I think it was for a medical reason, not because of activity, but I don't know, and I didn't ask. I'm not being judgmental here. If you suspect they're pregnant, what do we need to know? If somebody was in a crash and says, yes, they could be pregnant. When was your last period? Have you had any severe cramping, unpleasant odors? Are you taking birth control pills or other type of birth control? I don't know that how many partners you've had necessarily is important in our case. Urinary tracts, we need to know how often they've been, well, even with dehydration. Have you urinated lately? Is it regular? Does it hurt? Is there a lot or a little? What color is it? Why do I want to know a color? Possibly issues with blood, yes.
Whether it's clear or not.
Right. Is it brown? Is it orange? Is it red? When is red urine normal? Anybody know?
When you're taking the cranberry pills.
Beets.
Yeah,
Beets
when
are
you
famous for turning your urine red too. Orangey red. What? I think it has to do with how fresh they are too. Because it's put me in a panic a time or two, and then I remember, oh yeah, I ate beets, I'm fine. Probably vitamin A and carrots, too many carrots. When people are throwing up, ask them what it looked like. Does it look like coffee grounds? Does it have bright red in it? We do need to know this. We picked up somebody who's, my gut was telling me this person's in shock. Person's vitals were perfectly stable. We did not go into the bathroom. Had we gone into the bathroom, it would have looked like somebody had a crime scene. There was blood everywhere. Yep, she had a major bleeding ulcer going on. And she had blood all over the place in there, but she didn't take us back there. She didn't tell us that she was sitting out here on the couch saying, yeah, let's go. Her vitals were not changing because she was on a beta blocker that would not let her heart rate speed up. So in looking at her, I'm panicking, thinking she's going into shock, she's going into shock, vitals are not doing it. I should have looked at the meds and recognized, oh yeah, beta blocker. She's going into shock. I wondered for a long time, the drawback for me in EMS is that we don't know what happens to people. It's nice to know the outcome. And it kind of panics me sometimes. When I saw her again, we got called again, I don't know, 6 months, 9 months later. And I said, oh, I'm so glad to see you alive. And my fellow EMT looked at me like, I can't believe you just said that. But she knew what I was saying. So after that, she called me when she got back home after these runs, because she did become a frequent flyer to let me know she was okay. How do you deal with people who don't want to talk or can't talk? I watched a video where they sent a dad off to go into their room and look for something. Oh, take this officer and go look in his room. See if there's any clues to why your son's down here. Sometimes they're just super shy. Sometimes they're try to be as sensitive and empathetic as we can be. Most people around here are super embarrassed that somebody called you and don't want to bother you. Ranchers are a crazy breed. No, I'm fine. I don't want to disturb you as I have a bone sticking out. No, I'm sorry. You're coming with me. I cannot leave you here. You do. I got one lady that as I walked in the door, she told me, I hate you. Did I take offense? No, she didn't hate me. She hated the situation. So I told her, I'm sorry, I love you. And she said, well, come see me when I don't need you. So, okay, I understand. Oops, I'm not recording this. You can
It's a
get the
little
last
late now, Becky.
I think Brandon is recording it onto his YouTube thing.
That's what I hear. Brennan does that. Hopefully he didn't get the test answers on it. Overly talkative people. Do you pick up people that just talk about everything under the sun except for what you want to know? How can
That's
you
why
get them to focus?
Past medical history.
Yep. Yeah. Try to figure out what it is. Exactly. What about symptoms? Multiple symptoms. I got a whole bunch of craziness. Perfect example the other day. Heart's throwing PVCs and doing really weird things, racing 100 miles an hour. I'm doing this. I'm breathing really fast. How come? What's going on? Heart seems fine. Lungs were clear. What's going on? Or I feel like I can't breathe. Yeah, blood pressure and pulse are out of whack. No real reason. It can be a puzzle. Trying to figure out. Anxiety. A lot of people are very, very anxious when they get there. Sometimes the anxiety level goes up when we show up, and sometimes it goes down. Just people on scene have a very high anxiety level. Is that helping the patient?
We're being had the truck and brought into the hospital. Blood pressure dropped to 150 over like 80 something. I mean, just that fast. We had one where the mom and the son were in the vehicle and the mom was like causing more anxiety for the little boy. We separated them. He was
Put them in
totally
two different vehicles.
yeah. And she had calmed down a little bit. He wants to. completely, like, went from here to here with the.
Just having a. Yeah, calming people down and being calm yourself are one of the major things that can help most. Just stay calm and they figure, well, if you're okay, then I'm not dying, so we're good. Sometimes you get real interesting questions. Yes. Uh-huh.
Brandon EMTs from different parts of South Dakota, South Dakota. He got head to toe and he was like, it was their visiting, but I'm gonna do it. It was so fun.
On the mountain, I'm amazed most of our calls have medical people there before we get there.
Yeah.
It's very handy. What about intoxication? Or anger and hostility? They do. I had one threaten to shoot me. I wasn't too concerned. He couldn't get up off his floor, so he sure as heck couldn't go find his gun. I had another one threatened to hit me one time because I started an IV. He knew I was starting the IV, but I failed to say, poke in 3, 2, 1. He was on a backboard and couldn't see what I was doing. So when I started it, he says, oh, I'm gonna hit you. And I said, wait till I get it taped down so I don't have to do it again. By then he was laughing and I said, okay, you can hit me now. And he just laughed and that was the end of that. So sometimes humor can help.
Get him on.
Yep.
Where are you gonna lose his house? Oh my God.
We never did get him succeeded, or did we?
We did.
Okay. Yeah, he wasn't very happy with us.
No.
You saw us the next day, he wasn't very happy with us. And there was nothing wrong.
Yeah.
But we knew that. Oh, did he? Oh, okay. You also get the ones that are so intoxicated that they suddenly think you're the most beautiful person in the world. And I say, okay, I know you've had more than 2 beers. Please tell me how many you honestly had. Because I'm not buying this. Ironically, it's the same one that was going to shoot me because he was mad at me the last time. The next time he thought we were the most gorgeous people. Crying patients. Crying. What about little ones that are just screaming their heads off the whole way? They have an airway. We're good. It is. And it's very hard on your nerves. And in this case, I should have sent the mom up front and left the dad in the back because the mom was agitating the whole way. And I was just. And in my EMT, I was trying to get out of sight because there was nothing really that needed done. My EMT's trying to massage this kiddo's feet. My dog likes me to massage feet. Well, that's nice. This isn't your daughter. You are stranger danger. So they are. And my little grandson, he went over, he had to go to primary children's. Thought it was great because a fire truck came to get him. It was a red ambulance. And he was grinning the whole way and playing and fascinated by the machines and loved the whole thing. I mean, he was just in 7th heaven. Drugs can be awful. What about depression? And you have those ones that have something that's triggered when a certain person steps in the door. Guard talks about one in Moreland that wanted him out as soon as he showed up. I actually saw it in Ten Sleep. He showed up and she said, get him out. And he had to go out. And this person talks about confusing behavior or history, was being very irrational, and I was trying to talk to her rationally. And on the way to Moreland, I said, you can't talk rational to someone who's irrational. And guard said, exactly. So just get her moving and let's get her out of here because you're not going to talk her down. I said, oh, okay, that made sense. People with limited cognitive abilities that don't understand what you're doing or why. Don't understand who you are. Keep your medical terms very simple. As I've told people, never, never, never when you're checking an capillary refill, tell a kid you're going to pinch his finger. Never. That finger disappeared and I never saw it again. And he wanted nothing to do with me. You can always just push on the hand and you can check capillary refill. You don't have to check a fingernail. Language barriers. You ever come across one of those?
Oh, no. A guy who spoke Mongolian. And
Oh,
there's
my.
a cell service to try to use a translation app. So you're trying to do hand signals.
For
and
future
very
reference,
simple words. Communicate.
for future reference, if you end up with a Mongolian, call Alan Gottfredson. Because you had no cell service, that's true. We picked up one that was from, I can't remember, he was from Europe somewhere and couldn't speak English. Doing this. So my fellow EMT pulled out the knife drill and he goes, you pull out the blood pressure cuff and he goes, and you say, okay, this person has a history of cardiac problems because he knows exactly what you're doing. I got one that was deaf and they had just driven away with his interpreter, leaving me with the deaf guy, a bag of equipment, and here's his finger in a cup. Oh, good, thank you. We started communicating. We kind of wrote back and forth for a while. He could fairly decent lip read. I couldn't remember my sign language. By the time we got there, he was telling me how he got in a wreck and he cut his head. I told him he was crazy and he said, no, he's tough. So we've had a great time and we communicated just fine, but it takes a bit sometimes. I had a guy up here on the mountain that did not speak English. I can't remember if he spoke Portuguese or Spanish, but I was wishing I had one of my kids there to translate for me. But he pointed to his knee, so I took him to the light and was looking at his knee. In the meantime, my fireman kept checking me up and down with a flashlight, and he's looking at me questioningly. So I tried to show how I was driving down the road, and then my car went and went off the road. He says, "You?" And I said, "Uh-huh." He started laughing, thought it was hilarious. Didn't come with us. He was fine. He did have a bump on his knee, but that was all that was on his knee. So if they're hearing impaired, be sure you're speaking. Shouting is not necessarily the answer. If they are always that way, you need to talk to them looking at them. You can't turn this way and talk. They're not going to be able to read your lips if that's what they're counting on. People who are blind, if they're from another country and you're still speaking English, speak slower. They can't understand when you talk super fast. And everything we say is super fast compared to what they were speaking in their home country. So talk slower. Right. You show up and say, wow, this is not the language I learned. I'm betting if we need a Spanish translator, we call Regina. I figured as much. There used to be a lady at the hospital that spoke German, and they would get her there all the time. Visually impaired people. We do have one of those that's getting to be a frequent flyer here. Don't shout at them. Yep. But do let them know, I'm about to touch you. I'm going to check your head, make sure because I found out she fell and I just about started touching her first and I thought, whoa, wait a minute, as I'm inches from her head. I'm going to be touching your head and touching your neck and let her know what you're doing. Especially if the other one's the one in the back. Yes. And she has real hard of hearing in one ear, so you're usually shouting in the other. Okay. Secondary assessment. What's a secondary assessment? We did. That was a head to toe. Or in medical, you're focusing on whatever part is hurting. Sometimes with trauma, if they're saying, well, this person kicked me right here in my belly, do I need to do a head to toe? Not necessarily. You can do a focused one then too. Then we're going to do vital signs using all our fun toys. Should we take our first blood pressure using our fun toys? No, we should take it manually. Why? Because there's things you learn doing it manually. Is that heart regular? Is that heart irregular? Is there weird sounds in there? Is the heart going boom, boom, boom? Okay, lub-da-dub, lub-da-dub. Is there something weird in this rhythm that we need to know that you won't hear necessarily? If you touch them to take a pulse, you know what their skin feels like. You know what their temperature is. Don't forget to count respirations. That's the one that seems to be the hardest to get people to remember. Then you can use your machine after that. But the first one, you need to do it to begin with. This little figure 1030, if you have it on your book, is the colorimetric thing they were talking about with end-tidal CO2. It lets you know you're getting carbon dioxide out. But it's only good. It doesn't change from one to the other. It'll change once and no. But they also can be purple to begin with when you open them up, and they're not supposed to be, which is why they're not as reliable as end-tidal CO2. Okay, glucometers. Why do we need to know? Why would we need to do a glucose? Check for low or high. Only diabetics? Nope.
Altered level of consciousness.
Just what?
When you have somebody with that altered level of consciousness.
Right, altered mental status. You got it. Or you have some really weird symptoms that aren't matching. Yeah. Are you hurting them by taking a blood glucose? Right. Low blood sugars can mimic a lot of things. We had a person that wrecked a bicycle on the mountain that was altered level of consciousness. And because they were diabetic, some dear souls started poking sugar in their mouth before we got to the scene. And their sugar was like 531, really high. When they got to the hospital, dear EMTs said, 10 sleep did it. 10 sleep did not. Nurse on scene was poking sugar into an unconscious person. Please don't do that, especially without knowing what their sugar was to begin with. But yes, it was head trauma that had him unconscious.
So Becky, question.
What?
Question.
Yes.
So ARC teaches their lifeguards to give sugar when they don't know if it's a hypo or hyper, emergency when it comes to blood sugar. So what?
Okay, if you have a known diabetic and they're not acting normally, it's not wrong to give them glucose if you can't check it. If they are conscious, you can take it. Do not put sugar in somebody's mouth if they're unconscious.
I always figure it's better to have a high sugar than a low sugar.
It is. The low sugar is going to kill you faster. The high sugars, continuous high sugars are what cause things like the blindness and the kidney damage and the neuropathy. It causes the complications that happen later down the road. One high sugar is not going to kill them, but one low can. That doesn't mean anybody diabetic, I'm telling you to give it to anybody if they are conscious and they're exhibiting symptoms of a low. If it is a sudden onset, if it's something that's, oh, they've been getting worse and worse and worse over the last week, I'm not giving them sugar without testing it. Because the high takes a while for it to build up. And some people get used to running at 500 sugars because that's what their body has all the time. They never get below it. It is. Some people don't get symptoms when they're 40. That's where I always ran. Yeah, we'll get more into diabetes when we get there. When you take vital signs, you need to know what's normal. Table 10.5 is your normal vital signs. Notice that pulse rate's lower when you're sleeping. I panic people when they take my heart rate, because I'm in the 40s and 50s now. That does not mean I'm having any problem. No, I'm not dizzy. No, I'm not this. And finally, medical people have accepted it and they quit asking. One lady said, well, the alarm went off and you didn't react, so I figured it was normal for you. Because yes, I am normally low. There are people, especially women, especially the ones that are about this big around, that normally run with low blood sugars. Not blood sugars, low blood pressure. They might be 90/60 normally. So if you're getting something that doesn't seem normal and it doesn't match their presentation, ask them what's normal. A lot of people that run that low will know they're that low. They'll say, yep, that's normal for me. Temperatures. We're told, if you look at this book, 98.6 is the normal body temperature. In Wyoming, I'm told by medical people that nobody's 98.6. That's a fever here. Or hardly anybody. I run 96.8, not 98.6.
Evidently, the amount of temperatures that they took during COVID, they found out on average people's temperatures are lower anyway.
Yeah, they're like 97s. They're not 98. So yeah, that's something I don't know why they don't change the book. Why do we listen to lungs? Okay. You're looking to see if they're normal. Are they breathing? Is it equal? Are they using accessory muscles? Are they shallow? Are they labored? And are they noisy? Do we have to be able to identify the exact noisy sound we hear? No, it's good, but not necessary. Striders, okay. There's two kinds of sounds you hear that's a wheezy thing. One is when they breathe in, and one is when they breathe out. What is it when they're breathing in? An obstruction or allergy, the anaphylaxis. When you're breathing out and it's wheezing, it's asthma. That's not a cut and dried rule. However, everybody's got to be different. Stridor is a brassy crowing sound that you can hear. That's a narrowing obstruction of the upper airway. It is good to distinguish, is there a sound coming from the upper airway or the lower airway? Your rhonchi and your crackles and wheezes are usually in the lower. We had a allergy person that wanted something to fix it. Said she couldn't breathe and it was getting worse and worse and worse. And they listened to her lungs and her lungs sounded fine. Listen right here. This is what's swelling, not down there. So you may not be able to hear the wheezy and whistly sound from here down below.
Mm-hmm.
That makes sense?
Yes.
And you can also hear a pleural friction rub. When you hear a rub, it sounds like when someone sits or moves when you're sitting on leather. You can kind of hear there's a sound of that. Oh, you can absolutely feel it when everyone is happening. People that have a pleural rub or pleuritis, it hurts like crazy. And rales is the proper term for the wet sounding lungs. And they say you can remember whales because they're the whales in the deep blue sea. Bronchi is congestion in the bronchi. If that helps. Be sure and check quality while you're checking pupils. Oh, neurological. You can check their status by their activity, their moods. Diabetes affects moods a lot. They can be anywhere from quiet and not moving to really angry and combative with either lows or highs. So you need to know the person, listen to the family member. If they say, this is not normal, you learn to tell in your own family, yes, this is high, this is low, and I can tell you which from a long ways away, whether they're feeling it yet or not. Find out what their perception is of what's happening. Do they feel uncomfortable? Are they, especially neurological, we'll get into more of that when we get into the strokes and such. Coming up soon. Pupils. Are they teeny tiny? Are they great big? Do they move when they should? Is one pupil moving and the other one not? Is one really big and one small? It helps to ask, is this normal for you? Oh, look at that.
Yeah. My baby. He needs some attention.
Uh-huh. I had a kiddo we picked up after wrecking a three-wheeler that had one pupil that did not react at all to the light, and it was bigger than the other one. Scared me to death. I looked at my other EMT and said, this is one of my first calls. Handed him the light. He checked it. And he looked at me all scared to death. Mom was in the back and said, oh, he was born that way. That eye's not reactive. Oh, phew, good to know. Since then, I know several people intensely, and well, there's ones from Burlington that have unequal pupils. So it might be normal. Look at the whites of their eyes. Yeah, one won't react. Sometimes they've had eye surgery and they'll tell you I had surgery there and it's not reactive anymore. Maybe they've been to the eye doctor and it's not reacting because they put the drops in. In which case, please don't shine the light in and cause damage. We put down, are they equal, round, and reactive to light? Apparently, when they get to the hospital, they add accommodation to it. And I'm not sure what that is. So we'll have to ask somebody else that does know that. They're just assessing all the other things. When you're checking people, have them squeeze your hands. At the same time, put your fingers in their hands and say, squeeze, squeeze, squeeze hard as you can. Most people are afraid of hurting you and they just kind of, and I go, no, 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 squeeze. And they'll say, really? Okay, okay, that's good, that's good. Thank you very much. Walk away doing this, but hey, that's what I ask them to do. Have them push their feet down with your hands on the bottoms of their feet, like they're pressing pedals. Put your hands on top of their feet and have them lift their toes towards their head. Can they do it? Is it equal? If there's a weakness, is there normally a weakness because of something that happened in the past, or is this something new? If they're not able to move something, you may want to be careful in letting them know they're not able to move it if they think they're moving it. I am, it's moving. Aren't you seeing it? Oh, yeah, you're fine. Let's move on to something else because you don't necessarily want to cause panic. Okay, so reassessing, you're rechecking the vitals, you're rechecking the chief complaint, you're rechecking anything you did. If you have an IV, keep an eye on it. If you gave meds, you're reassessing what you did. You are identifying any changes in their condition. And how often are we reassessing? Okay, if they're critical, you're doing it every 5 minutes. If they're pretty stable, they can do it every 15 minutes. You can actually set your machines to do that, or I have one that sets a little timer on her phone when they're in the back of the rig, and they say, oh, time to do it again. And I don't know if she has it on buzz or what, because I never hear it. All right. That was only part of what we were supposed to do tonight, but we'll figure out how to do the rest of it some other time. I'm trying to get caught up. Well, let's do this part. Medical overview. Like we kind of did that. How we need to be sure and talk to family members, bystanders, pill containers. We did that. We did that. I'm looking at the outline. Okay, we did it. You're good. We did the medical overview because I was telling you how we have to play detectives and these are things to look for and all that fun stuff. So next class is, what is this? This is Monday. Saturday. I don't know what time or where yet. I will keep you posted on that. And let you know when we will meet. Well, it's next Saturday, but I don't know if it'll be, usually I'm trying to encourage these people to start between 8 and 9, depending on who's doing it. It will be by Zoom. It's not a have to meet in person. And I will catch you all next time. Are there any questions? It's a lot of reading. Oh, did everybody that needs a number to get to the book stuff? I emailed one to you. I emailed one to you this morning. I just emailed them this morning. If you don't have a number yet, please check your email. Those of you who are just doing this for hours, I may not have gotten you one. If you really, really needed one, let me know and I will get one to you. Yeah, there's not a lot. Well, there's page numbers. I don't understand. You each get your own access code. So I sent you one access code and then instructions on how to use it. So if you received an access code in the email today, that number is yours. That's what you use to get on. Okay.
Hey,
We'll catch
Becky.
you all Saturday then. Yes.
Go ahead, Em.
Oh, I was gonna say just we've got a fire department activity in the morning. So if you guys are available in the afternoon or you do it at something in the afternoon, I'll be able to join you.
Okay. If not, we do have it recorded and you can watch it. Brendan has it on his YouTube channel, and I think I sent that out in an email today too and forwarded it to you guys.
Sounds good. Thank you.
Uh-huh. And you can go back and see the ones that you missed anytime on his YouTube thing.
Hey, Becky. Did I miss the first test scores?
You're wanting to know what your score was? I thought I sent that, but I may not have. Is this McKenna asking?
It is.
Yes, I will send that to you.
Thank you so much.
And I'll get them sent to you.
Thank you.
And I still can't get to any test questions, so I'm deciding what to do for a second test on that one for people who wanted it.
Okay.
So hopefully maybe I'll get that figured out by Saturday. I'm sorry, life's been insane lately. We were paged today to a call that was like an hour and a half to 2 hours way up to the south end of the county.
Oh, goodness.
Thankfully, the helicopter got there about the time they did. Anyway.
Thank you again, Becky.
We'll see you guys. Thanks.
Thank you.
Thanks.
Peggy.
Okay.